I'm Stephanie Nemmers. I am the nurse practitioner with the SHINE Palliative Care team. SHINE stands for Sharing, Healing, Inspiring, Nurturing, and Enduring. We're a pediatric and perinatal palliative care program. In palliative care, we work with patients and families living with complex chronic conditions. And our goal is to help enhance quality of life for these families. And we do that by focusing on three major areas of care. We focus on symptom management. So we help with physical symptoms that could be distressing to the child. So any pain, nausea, vomiting, diarrhea, constipation we can assist with. We also help with social, emotional, and spiritual symptoms that could be causing distress to the patient or the family unit. We also help with communication. So we ensure that our patients and families are getting honest and timely information to all of their questions. We also help families establish their goals of care. So what's most important to them given their understanding of their child's condition. We help them weigh the benefits and burdens of the medical options that they're being presented and encourage them to make decisions that align with their family's values, their beliefs, and their definition of quality of life. We also help families with advanced care planning when appropriate and care coordination. And our third role, which I think is our most important role, is to provide support. So we provide an additional layer of support through the ups and downs of the medical experience of the family and patient. And it's important for our team when we're having these difficult conversations with families to be compassionate listeners. Every family has a unique experience and a unique story to tell. So it's our job to listen and to hear that story in order to individualize our care for the patient, to build trusting relationships, and really to foster hope for the future. Oftentimes, when I meet with families for the first time, they are doing just enough to get by each day. Like the Sneed family, trying to balance their work, their home life, and now a child who has complex medical needs. When we first sat down to have a palliative care family meeting, we talked about Jackson, his complex needs, the family's goals of care, what quality of life means to them, their hopes, their worries. And it wasn't until the end of our meeting where the family thought, wow, we do need a little support. Our care doesn't stop after our first visit. It continues through the lifespan of their child. And also, our job is to help them foster hope and foster hope for the future. The SHINE team consists of nurse practitioners that see all of our patients and families and work in collaboration with the child's primary care provider and other subspecialists. We also have a great team of directors, including a medical director, that helps guide our team in program development. And in palliative care, we rely on the expertise of interdisciplinary team members throughout the hospital, outpatient, and home settings. So we work very closely with child life, creative arts therapy, chaplaincy, social work, care managers, nurses, doctors, the therapy department, the home team, and that's just to name a few. And we work with them closely in order to provide comprehensive palliative care services to our patients and families. To consult the SHINE program, it requires a provider order, and that order can be placed in Epic, followed by a phone call to our palliative care office to tell us about any special details regarding the family. And then we respond within 24 hours, Monday through Friday, 8 to 4:30 p.m.
So Jackson was born, we had a very uncomplicated pregnancy and had multiple ultrasounds, and nothing was ever looked abnormal or anything like that. And so he was born and perfectly healthy, and we counted fingers and toes, and we were all laying together, and your typical post-birth experience. But then he went to nurse for the first time, and the milk came out his nose, and he gagged, and the nurse kind of thought it was weird, and she suctioned him, and he nursed again, and it happened again, and then they listened to his lungs, and they found his lungs had been clear, and now they were full. And that was when they went to pass a catheter to deep suction, and the catheter wouldn't go, and it stopped inches below his neck. It was a whirlwind of a diagnosis. Obviously, went from expecting nothing, having a perfectly healthy baby, to now you're facing a very uncertain future. Stephanie came in probably around like 4 or 5 days. The baby was still in like a medically induced coma after the surgery. And she just kind of came in and introduced herself, and I was immediately kind of on guard, because I think in that moment you as a mother are thinking, you know, I got this. Like I can handle this for my baby. And but she immediately put me at ease, and I didn't even realize it at the time that I needed that go-between. You're thrust into this medical world that you never kind of imagined being a part of, and you do need that kind of interim person to help you navigate the language. And so that was kind of when we met her, and our relationship kind of started there. Mm-hmm. Sure. So Stephanie did a really great job. She was there for rounds whenever she could be, and I feel like it was most days. More days she was there than she wasn't there. So when the doctors round, they give a report, you know, on what's going on that day, like where's your child at, and that can be a daunting process because they kind of talk quickly and they're, you know, laying out the plans for the day. And so Stephanie would come in after rounds and say, do you have any questions about what was discussed? How did you feel when they were talking about this new diagnosis? And so that was just amazing to have her there to kind of process what happened that day, and just to kind of have her there every step of the way. Just having that point person, having someone that you can call. And I did. I kept her card in my phone case, and I would just whip it out and call her whenever I needed something. I knew I could email whenever I needed, and just knowing that I had that go-to person, because there's so many, there were so many specialties. We had pulmonology, we had surgery, we had GI, we had, all of these different medical teams, and just kind of to have that point person that I knew was there for me whenever I needed was really priceless. Stephanie is she is so interested in how are you feeling, and I immediately thought, oh, she's analyzing me, like I've just got to put up a wall. But that lasted all of maybe one day, because I immediately knew, okay, she's genuinely interested. She really wants to know, how we are handling this and what she can do to help. And she did. She went above and beyond, and she did so much legwork for us. And yeah, now we're friends for life. So.
They were young enough where they kind of knew what was going on, but they didn't really fully know the extent of how serious it was. But whenever they came to the hospital, they had, if they needed anything, that was provided. They had a place to go play with toys, or even play toys in the room, and a park outside that they played at a lot. And just everyone was really accommodating to them and wanted them to be around as much as they could, just to be, so they could be around Jack and around us, and that was real helpful. Yeah, she was here, from the beginning, and then even when we left, we're up at Mayo, she actually helped us get transferred to Mayo, and then did a lot of legwork on that and talked to the doctors. And then even when we were at Mayo, when we wanted to come back, she's the one who got us back fast and in a good timetable. And we still, if Kelsey has questions or concerns, she still will email her and ask her about certain things and if she could help with this or that. So it's still ongoing a year after Jack being in the hospital. At first it was pretty scary, going from a hospital and having all this care on him all the time and then going home. And so that was initially scary, but we got to the point where it got easier and easier, and he had a few sicknesses, but nothing too serious. And now it just seems like he's, a normal baby. He's still got the G-tube, but he's pretty normal compared to, his brothers and everything else. And he's just doing so well, and he's so happy and easygoing. And yeah, it's our new normal, really. So.